Good evening to everyone and welcome to today's session. So we made few improvements. But if you want to really enjoy this game, you need to get into the Incus Quiz app. You need to download the app and be able to participate. But still, we try our best to run the show as our earlier show. So if you take the app, you can be able to answer the questions and can be able to know what is right, what is wrong answer, how others are answering, etc. So, but to do that, before only you need to register, and at least 10 seconds before the game starts, you should be in the room, waiting room, and then enter into the game. That is very much required. Otherwise, you miss the game. So that is the main difference between what it was earlier and now. So thanks for all of you for joining the session, most importantly. So now, from the next question we will take up. So yeah, this is a question on ectopic pregnancy clinical presentation, where a 28-year-old woman with a sudden onset of severe abdominal pain. Always severe abdominal pain if a woman has presented, along with shock, you should strongly think the possibility of ectopic pregnancy. Now, what is your bet on this 62-year-old man with hypertension, decreased urine stream, nodular left prostatic lobe, there's a tenderness from the lumbar vertebral bodies? What is the next best investigation you want to do in this given clinical scenario is the question. So, how do you evaluate a metastatic prostatic carcinoma is the basis of this question. So, good to see Hamid Ali correctly answering this question. So, you should be quite sure on the clinical management of metastatic prostatic cancer. Now, a 40-year-old man with no perceptible axillary adenopathy and 1 to 2 centimeter tender cystic mass in her breast. So you need to do a fluoroscopically guided needle localization biopsy is considered to be the management of choice. So that's good. Once more, Hamid Ali is rocking the answers. And now, 60-year-old woman, dry mouth, gritty sensation in her eyes. So dry mouth means salivary glands are destroyed. And gritty sensation in the eyes means there is a destruction of lacrimal. Typically, in the case of the Sjogren syndrome, so that is the reason you need to evaluate it by doing Schremer's test and measure the autoantibodies. Both the participants have correctly answered. Surya Nikhil and Hamid Ali, very good. Now, typically, the mother who delivered a baby is a carrier of hepatitis B surface antigen. And what do you want to do in the given scenario? So, pregnancy with HIV, pregnancy with hepatitis B is a favorite question of the examiner. So, you need to administer hepatitis B immunoglobulin, and also the hepatitis B vaccine is what you need to remember. Very good. Hamid Ali and Surya Nikhil, both of you are right for this question. So some of you among the audience are thinking that, sir, how to participate in this quiz? Please download the Incus quiz app and go to NEET PG category, and under that you are having the tournaments and what is the time. Please don't forget to register, and at least 10 seconds before tournament be into that room. Unless you are into that room, you can't play, at least 10 seconds before. So that is a constraint in case of Incus quiz app. So, but every hourly across the day, you have the quiz tournaments on the Incus quiz app for the NEET PG entrance exam, starting from morning 8 a.m. to night 12:30 p.m. So that's the reason, just keep yourself tuned to be into the game. After this, once more at 8 p.m., we have the next quiz coming up. So, but for that, you need to download the app and register for that particular tournament. And at least 10 seconds before the start of the tournament, you should be in the game room in order to join the tournament and start answering. Please don't forget. So, very good. A 49-year-old with multiple myeloma with hypokalemia, hypouricemia, aminoaciduria, proteinuria, that is, kidney is affected, proximal tubules are affected, there is a aminoaciduria, etc., etc. So, proximal renal tubular acidosis along with aminoaciduria, everything will make it a Fanconi syndrome, is what you need to remember. And that makes both Hamid Ali and Anisetti Surya Nikhil, both of them are absolutely right. Now, a 34-year-old with calf dyspnea lymphadenopathy. There is a cervical lymphadenopathy, hepatomegaly, hilar lymphadenopathy, bilaterally symmetrical. So what does it suggest you? It typically says it is sarcoidosis. So that is the reason you need to do bronchoscopy with transbronchial biopsy is considered to be the management of choice, is what you need to remember. So only one of you have correctly answered. That would be in fact none of you. So yes. Now, a 53-year-old with complaints of weakness, anorexia, malaise, constipation. So the serum calcium levels are 14 milligrams per deciliter, and creatinine is 2. And considering all this, how do you want to basically manage? So always, whenever there is any polyuria associated with hypercalcemia, saline diuresis is considered to be the management of choice. Very good. Hamid Ali absolutely cracked the jackpot. So, very good. The last question for the evening is, for this quiz tournament is, the parents of 8-year-old boy with normal IQ are very concerned because he's a very slow reader and he does not appear to understand what he reads. When the boy reads aloud, he misses the words and changes the sequence of letters. So you should be very sure about the various speech and learning disorders. So often there is also an association with the other language abnormalities. So very good. So that brings to the end of the day. Finally, we have the leaderboard. Hamid Ali from Kadapa scored 13 out of 20. Very good, Hamid. Anisetti Surya Nikhil scored 10 by 20. Very good. Proud of you. And that's good. So, Doctor, this is how our quiz tournaments on the Incus. Don't forget, download the Incus quiz app. Most important. And once more at 8 p.m., another 15 minutes, we will meet up and then play the next quiz. But after the quiz is over, please don't forget, just go to the Incus quiz app, download the Incus quiz app, go to the NEET PG exam. So I'm trying to explain you how you go about. So once you go there, then you can be able to see what is the next quiz. So today is 12th. So you have at 8 p.m. one more medicine quiz is there. Okay, at 8 p.m. So don't forget to click on the register. So once you click on the register, you will be getting a sign that please click to enter the room. Don't forget 10 seconds before the start of the quiz, you should be inside the room in order to start the play on the Incus quiz app. So once you click on the enter the room, it will say contest starts. At least 10 seconds before, now it is saying 13 minutes, 49 seconds, 48 seconds countdown. You're able to see when the contest is going to start. So you should all be ready. So download. Once more, we are going to have a discussion. And after the quiz is over, right? Typically, whatever that you have played, you can see in the bottom history. So once you go to the history, you will be able to see all the tournaments that you have played. Just now, we have played the medicine quiz. So whatever the tournaments you have played, you can see, you can review all the questions, right? So shortly, we are introducing a feature of adding explanations. You too can add comments on the question. So many new features. You can bookmark certain specific questions. Everything we are organizing shortly in the next versions of the app. But until then, enjoy. Keep enjoying playing. Keep yourself fully ready for the exam. So every day you have totally 20 quiz tournaments. 8 a.m. anatomy, 9 a.m. physiology, 10 a.m. biochemistry. Starting from there until 9 to 12 p.m. every hourly you have 20 question quiz tournaments where you can play with all your friends. Whenever I can join and have some discussion, always I step in and we will have discussion. And every question we will give you 20 seconds to answer. Then only you will get that thump-like feeling that you are completing the exam, right? So every month you have 600 quiz tournaments across 30 days, and it's very affordable. Hardly you need to pay 600 bucks for 600 quizzes. 1 rupee per one quiz tournament. No one in this world can offer learning so cheap, right? So please don't hesitate. Today only, download the app and register yourself to the games and keep playing. So once more at 8 p.m. Please don't forget, go to the NEET PG exam category, and under the NEET PG exam category, you can go down and you can see that medicine quiz at 8 p.m. We're all going to play. Till then, I'll keep waiting for all of you to join the game beforehand, register, and 10 seconds before be in the room, and then we will all play. Till 12:30, I keep playing every half an hour one game until 12:30 p.m. Are you all ready? Hopefully. So, welcome everyone. The next medicine quiz is starting. Now, a 72-year-old woman is seen with a 4-month history of difficulty in swallowing of liquids. There's a brisk jaw jerk, which is a very, very important clue. So always a brisk jaw jerk should remember about pseudobulbar palsy. So once there is a pseudobulbar palsy, you should think of motor neuron disease is what you need to remember. Hey, Gangavaram Raghuvaran, please download the Incus quiz app. Good to see Akhilesh has joined the game. You should download the app beforehand, and you need to register for the game, and at least 10 seconds before you should be in that room. That is very important. So below this video which you are watching, you can get that bit.ly link. You click, you will be in Google Play Store, and from there you need to download the app, then come to the NEET PG quiz tournaments and then play. So levity recita, you should remember, it is very well absorbed by the oral route is a correct answer. Good. Now, a 70-year-old female with 2 months history of apathy, withdrawal, urinary, fecal incontinence, and insomnia. So what are the various lobes in the brain? How do they function? The various lobes in the brain is one of the favorite questions. So you should be very sure that what does frontal lobe does? Frontal lobe is the one which maintains our continence. Any frontal lobe dysfunction is known to lead to development of incontinence is what you need to remember. Excellent. Akhilesh Mahinder absolutely rocks. Yes. Thank you, Sandeep, for helping our medical students. Sandeep is our top-notch architect in technology. So any doubt, please do call our helpline. Now, 35-year-old with wrist drop, classical of radial nerve injury. So very common, an alcoholic individual has gone sitting on the side of the park on the table, and then he got radial nerve palsy. Classical question. Very good. Akhilesh Mahinder rocks on the top. And gentlemen, tonight we are uploading the Incus quiz app even into the App Store. So in a couple of days, it should be available. So if you have iPhone, you can download the Incus quiz app and play on that. A 42-year-old obese woman, epigastric pain, profuse vomiting, tachycardic, with left upper quadrant and normal bubble sounds. So classical of acute pancreatitis. So that is the reason serum amylase is the one which you need to evaluate. Very good, Akhilesh Mahinder. Now, the fetal movements which are felt for the first time in a mother's third pregnancy. She's a multiparous woman. So when do you think the fetal movements will be felt? At what time? This is one of the favorite landmark that you need to remember. So it is 16th week where the fetal movements will be felt by the mother, especially a multiparous lady is what you need to remember. So our friend was guessing it as 12 weeks, but Akhilesh Mahinder, very good. So scores correctly. Now, 21-year-old woman collapsed at party. Her friend says she has drunk several bottles of beer before acting strangely and collapsing. She's having incontinence of urine. She's tachycardic, clammy, sweaty. They're all suggestive of what, doctor? Sympathetic activation. So sympathetic activation typically occurs whenever you are having hypoglycemia. It's quite common that the people who are on a binge drinking can end up in hypoglycemic episode. Very good. Akhilesh Mahinder really rocks good. A 55-year-old, hemoglobin 13.8. Oh, MCV is 106. That is, it is macrocytic. Target cells, hypersegmented neutrophils. What else do you require but to make the diagnosis of megaloblastic anemia? But that's right. So, yeah, only most of all of us naturally will think it is vitamin B12 deficiency, but hypersegmented neutrophils are there. Even D can be the correct answer. Option D also is the correct answer. Now, what happens if there is any parietal lobe lesion is a very important question. So all these quiz tournaments will give you only 20 seconds time. You know it, you know it. You don't know, you try to know it. That's the typical approach. So a lesion in parietal lobe lead to inferior quadrant anomia, whereas in temporal lobe lead to superior quadrant anomia. Always superiors have a very bad temperament. So you can remember temporal lobe, superior quadrant anomia. Guillain-Barré. What is the classical clinical manifestation of Guillain-Barré is a very, very important question. So, what is your answer, doctor, for Guillain-Barré syndrome? Very good. In about 50% of cases, there is a bulbar involvement of the brainstem, is what you need to remember. That's the reason whenever you have a Guillain-Barré patient admitted under, you would be ready with a ventilator. Any moment, the person may require going to respiratory arrest and require a ventilator. So, demyelinating polyneuropathies, axonal polyneuropathies. You should know the differences. So, which of these is typically demyelinating polyneuropathy is a very, very important, interesting question. So, you have to be sure HMSN, hereditary motor sensory neuropathy, is an example of a demyelinating polyneuropathy. Once more, the list of causes of demyelinating and axonal neuropathy, you have to be 100% sure about, doctor. Now, a 18-year-old female presents with bilateral ptosis. She's having tiredness in the afternoons. She has a short tensilon, and you have made a diagnosis of myasthenia gravis. So what is your best management? You need to purge out all those autoantibodies. So that is the reason there is a role in this given case for plasmapheresis is what you need to remember. Very good. Akhilesh Mahinder has done a wonderful job correctly answering. Excellent. Now, a 55-year-old man has progressive weakness of his hands over a period of 1 year. There is hyperreflexia. Sensation is normal, very important. What are pure motor neuropathies? What are sensory neuropathies? What are sensory motor neuropathies? So always in motor neuron disease, what is the important clue? It is purely motor, never sensory. That is a very important clue. So that is the reason the answer is motor neuron disease. Very good. Akhilesh Mahinder rightly answered. Now, what are the causes of a small pupil? Small pupil. So you should remember pinpoint pupil with pyrexia, triple P it is called, is typically a feature of pontine hemorrhage is what you need to remember. Pinpoint pupils are the indicators of pontine hemorrhage is what you should remember. Now, doctor, Very good. Once more, Akhilesh Mahinder rightly answered. Super. A 68-year-old with a mass in the anterior triangle of the neck. It has increased in size over the last 12 months. So, very good. So, what is your answer, doctor? Yes. So, the next question, yeah. What is true about alendronate? Alendronate, what is true? So, are there any special precautions about taking alendronate? Biphosphonates? Yes, very much. All these biphosphonates can lead to esophagitis. So one of the important instructions you should tell the patient is, sir, please take a full glass of water and remain in the erect position. That's what you will advise. Very good, Mahinder. Mahinder, absolutely right. A 62-year-old, 3-month history of intermittent constipation and diarrhea, progressive weight loss, he's schizotic and has a knobbly hepatomegaly, though he is not jaundiced. His liver function tests are surprisingly normal. Yes, that's very much possible in case of liver metastasis. Sometimes colon carcinoma-like conditions, there can be Majumdar wrongly thought it as lymphoma, but Mets can present like that. LFT can be normal, and when you do the evaluation, you may discover the presence of metastasis, is what you need to remember. A 23-year-old developed a swelling in his scrotum over a 3-month period. It is firm, painless, it rises from the left testicle. He has a history of asthma. So, and past history of orchidopexy. Always remember an important rule. Doing orchidopexy for a undescended testis does not rule out the risk of developing malignancy. So that is the reason you need to do an ultrasound in view of his past history of orchidopexy to rule out any testicular malignancy. A 33-year-old smoker with hemoptysis of 3 weeks duration, left-sided hilar mass, left supraclavicular lymphadenopathy. So how do you want to evaluate this given scenario? Very good. So you have to do the sputum cytology. So every malignancy you should know how do you clinically approach is very, very important. So that's good. We have Majumdar wrongly answering it as option C, but still good performance by Majumdar. The last question you should remember, 30-year-old man, sharp pain when he's passing urine. There's also a thin discharge after micturition. He has a number of sexual partners and does not use condoms. He's a very free bird. So how do you want to evaluate the presence of prostatitis versus UTI, etc.? So it is a 3-glass test which is going to happen. So that is very, very important. So Akhilesh Mahinder, he missed the last question, but very good. Good for taking the participation in the quiz. So once more, all of you, I want to tell you, last 2 months I had been very busy because I wanted to bring up a mobile app, which is going to be your companion every day, every hour, while you are preparing for the NEET PG coming up in the month of January. So morning 8 a.m. 8 a.m. anatomy, 9 a.m. physiology, 10 biochemistry, 11 microbiology. Like that until night 12:30 p.m. a.m. Right? So till then you have a series of quiz tournaments. You just need to download the Incus quiz app, register for all these games, and it will give you a notification before the game starts. Quickly come and stay 10 seconds before inside the room for you to join the live quiz. Okay, so that is the plan. And I'll quickly show you. I will quickly show you. Once you come to the NEET PG app, Incus quiz app, you have the category, exam category of NEET PG exam. So once you come here, you have all the quizzes which are being posted and live for you to play. So when is the next quiz? Now it is at 8:30 p.m. Yeah, your next quiz is going to start at 9 p.m. 9 p.m. we are having surgery quiz. Okay, so what I'm going to do for this, in order to join the surgery quiz, what I'm going to do is, yes. What I'm going to do is, I'm going to click on the register button. I want all of you also to download the Incus quiz app. Below this YouTube video, you are having that bit.ly link, no? Just use that link, and it will take you to the Google Play Store page. So there you can download the app, right? And you can be able to play. Most important is, don't forget to register in advance. So that is very important. So once you register, it will say, click to enter the room. So once you click on that, you are in the room, waiting room. So it is saying next 42 minutes, 15 seconds, it is going to start. At least 10 seconds before the contest begins, please take part. Please be inside the room, right? And we will all play. And we will, you can compete with all your friends. Please tell all your friends. And I'm going to join once more for 9 p.m. quiz, 10 p.m. quiz, 10:30, 11, 11:30, 12, 12:30. I'm going to give you company to discuss with you the questions. All right? So till then, please stay online, and I will join the quiz. Okay, Manasa is saying 8:30 p.m. we are having OBG quiz. Oh, I missed it. 1 minute. Let me check. 8:30. 9:30 Henavita. Manasa. 9:30 p.m. we have the OBG quiz. 10 p.m. we have the NEET PG image quiz. Let us all play. Then 10:30 we have anesthesia quiz. I'll keep you to sleep. Dermatology quiz at 11 p.m. Then 11:30 we have psychiatric quiz. Let us become psycho in the midnight. Then midnight masala with Dr. Murali Bharadwaz. 12:10 p.m. a.m. early morning we have radiology quiz. Then we'll all say goodbye, ta-ta, and then join. Okay? So, doctor, just I already booked for the 9 p.m. quiz. Okay? Whatever the quiz time is over, it will go into autoplay. If you missed it, it will go into autoplay. You can always autoplay. Whoever played before you will keep their scores will compare with you every question. So no worries even if you missed it, but why don't we all play autoplay? That's the idea. Okay. So doctor, surgery quiz is starting in next 40 minutes. That's good. I will join all of you. Welcome back, everybody. Surgery quiz begins. 68-year-old complaining of right upper quadrant pain, remote history of open cholecystectomy, and it is a classical clinical situation, clinical vignette, which talks about the it is a classical clinical vignette which speaks about the pyogenic abscess. A 16-year-old is found to have firm mobile nodules in both the left upper and right lower breast quadrant. So what is your answer, doctor? It's also called breast mouse. The fibroadenoma is called as the breast mouse. Very good. Now, the next question. Oh, there are only 2 questions. I'm sorry about it. Yeah. Maybe the next quiz, we will try to have as many number of questions as possible. Unfortunately, only 2 questions got loaded. Yeah. So with this, I want to once more tell all of you that you all can download the Incus quiz app. We have so many mobile apps today available, thousands of questions available, but they don't proactively stimulate us to do the revision. Quizzing with everybody around us is the best way to prepare for the exam. So that is the whole purpose of the Incus quiz tournament app. Every day you have 20 quiz tournaments and 600 tournaments across the month, and that will keep you on the toes. Every day you get a chance to revise all the 19 subjects. With that, we will once more meet with some more quizzes. Whenever I get the chance, I try to anchor those sessions, but otherwise, you all can be able to play yourself simultaneously across the world. So don't forget, download the quiz tournament app, Incus quiz app. Thank you.